It is an honor and a privilege to introduce to you today Dr. Sherlita Amler, Commissioner of Health in Westchester County, Adjunct Professor of Public Health, Clinical Associate Professor of Pediatrics, and Senior Fellow in the Center for Disaster Medicine at New York Medical College. Dr. Amler reports to County Executive George Latimer and works closely with the Board of Legislators, Board of Health, hospital administrators, and healthcare providers to address vital community needs and improve quality of life for all of Westchester. Her skills and experience were paramount to Westchester's response to the COVID-19 pandemic since January 2020, as she led and oversaw case identification, tracking, quarantine and isolation, testing, vaccination, and school system policies. She oversaw and implemented safety programs for restaurants, fitness centers, summer camps, private businesses, and congregate facilities. Dr. Amler has more than 30 years of public health experience at the federal, state, and local levels. She has practiced as a general pediatrician, CDC physician, state district nursing services specialist, clinical microbiologist, and disease investigator. While at the CDC, Dr. Amler oversaw medical monitoring for anthrax on-site investigators and focused on prevention of mercury and lead poisoning, as well as all-hazard disaster mitigation and incident command. In particular, she dealt with hospital surge capacity and consequence management from large-scale events. As Westchester's Health Commissioner, she directs all public health services in accordance with state and county sanitary code provisions. Among these services are communicable disease control with clinics for STIs, tuberculosis, and immunizations, community health assessments, health education for healthy living and chronic disease prevention, and services for home health care, early intervention, and preschools. She also directs inspection and certification of restaurants and food vendors, swimming pools, public water systems, sewage treatment and disposal systems, as well as control of rabies, influenza, and Lyme disease, lead poisoning prevention, and public health emergency preparedness. Dr. Amler received her education at University of Texas at Arlington, Arkansas State University, University of Arkansas for Medical Sciences, and Louisiana State University, with specialized training at the CDC and at FEMA's Mount Weather Emergency Operations Center. She was recognized with the HHS Secretary's Award for Distinguished Service. She was named Woman of Distinction by the New York State Senate and twice named a Doctor of Distinction here in Westchester. She will receive the Friend of Medicine Award from the Westchester County Medical Center next month. So it is indeed an honor and a privilege to introduce Dr. Sherlita Amler as our commencement speaker. Dr. Amler.
All I can say is no wonder I'm always tired. So Reverend Clergy, Chancellor Halpern, members of the board, Dean Holtz, Dean Amler, Grand Marshal, distinguished faculty, alumni, honored family, friends, partners, and guests, and of course, the 2022 graduating class. Ladies and gentlemen, it is both an honor and a privilege to be your commencement speaker. I bring you warmest greetings and congratulations from the Honorable George Latimer, County Executive in the County of Westchester. And we in county government are so proud to be home to New York Medical College for some 50 years. Today, we mark an exciting milestone in the personal and professional lives of our newest colleagues, the graduating class of 2022, in the Graduate School of Basic Medical Sciences and the School of Health Sciences and Practice. What brain power is collected in this tent today? By my count, you have worked in nearly 20 different disciplines. Among the biomedical sciences, biochemistry, cell biology, microbiology, molecular biology, pathology, pharmacy, and physiology. In the clinical disciplines, physical therapy and speech-language pathology. Within public health, behavioral health, biostatistics, community health, disability and health, disaster medicine, environmental health sciences, epidemiology, global health, health policy and management, industrial hygiene, and I'm sure I probably missed a few. So tell me, what am I doing here as your commencement speaker? I'm not sure, but we'll try. As the Commissioner of Health for Westchester County, I work with and depend on many of your disciplines, and I can tell you that the COVID pandemic has actually brought new public awareness of the value of your disciplines that your value brings to our battlefield. COVID brought something else, according to Andy Kessler in the Wall Street Journal. He wrote that you probably expected to take a lot of tests when you came here, but you never thought half of those tests would require a swirling swab in your nose. My colleagues often quip that suddenly the public seems to know public health and why it's important. Well, they've also learned a lot about your disciplines in health science and practice beyond medicine and surgery, because it took more than just public health and ICUs to deal with COVID, from our first case in New Rochelle to the full-scale emergency. Every discipline has been engaged in this battle. The biomedical sciences examined the new virus and its evolving strains, sequenced its genome, and crafted new age vaccines that worked. Pharmacology, in particular, developed and evaluated new drug candidates. We used epidemiology to generate a portrait of COVID, its sources, trends, risk factors for adverse outcomes. Behavioral health science examined COVID's compliance, Behavioral health science examined the public's compliance with COVID safety measures, as well as vaccine hesitancy and suggested strategies to improve vaccination and disease control in the population. Environmental science and industrial hygiene informed our use of personal protective equipment, or PPE, and basic safety measures such as hand washing, social distancing, cleaning services, preserving air quality with ultraviolet radiation, and improved air circulation. Our clinical disciplines established and validated protocols to safely perform therapies in person when face-to-face contact is essential. And health policies and management set the protocols for contact tracing, case investigation, vaccination, and testing. And I predict that the need for your specialties will continue to grow as we begin to tackle the many facets of so-called long COVID. So whatever your discipline, welcome to the broad health workforce. Now that you've joined our ranks, we urgently need your energy, your passion, and your commitment to work hard and serve others. Since at least the 18th century, public health has intersected with many of your disciplines to protect against disease, preserve good health, and promote a culture of wellness. Dr. Edward Jenner's vaccination against smallpox has been credited by some authors, actually many authors, with saving more human lives than anyone in history. In the 19th century, Louis Pasteur, a chemist, made vaccines against anthrax and rabies. Robert Koch, a microbiologist and physician, gave us Koch's postulates to help establish the cause of a disease. And John Snow, the father of epidemiology, demonstrated that cholera was waterborne and preventable. The 20th century brought many more vaccines, toxoids, improved sanitation, countless new medications, and safe food and water that have resulted in dramatic improvements in infant survival, longevity, and the quality of life. A CDC meta-analysis in 1984 demonstrated that about 60% of the US deaths were occurring prematurely because their underlying causes were preventable. For example, tobacco use, which exploded in the early 1900s with the mass production of cigarettes, was found to be the leading underlying cause of death. And the automobile, another newcomer, was killing untold numbers before many safety features were instituted with help from traffic authorities and public health volunteers called Mothers Against Drunk Driving. The impact of our collective success is that we save millions of lives at a time, and the most grateful patients are the ones we never see. In 1999, CDC listed the 10 greatest public health achievements of the 20th century. Each was the result of interdisciplinary strategies and tactics, and in no particular order they are: a personal favorite of mine, vaccinations; the control of infectious diseases; recognition of tobacco use as a health hazard; safer and healthier foods; fluoridation of drinking water; motor vehicle safety; safer workplaces; decline in deaths from coronary heart disease and stroke; healthier mothers and babies, and family planning. The results have been dramatic. During the last century, life expectancy at birth increased from 47 years to 77 years. Let me repeat that. Life expectancy at birth increased from 47 years to 77 years. Half of the babies born in this country in 1900 died before their first birthday. Today, more than 99% of them survive. These successes were not the work of a single discipline, but came from interprofessional collaboration and a collective desire to make a healthier world. Let me put this in personal perspective. When I was a young resident, pediatrics, one of our constant concerns was meningitis in babies. We spent countless hours doing spinal taps. Now, with pneumococcal conjugate and Haemophilus B vaccines, meningitis has become so uncommon that today's pediatric residents barely learn to do spinal taps. And this is a development we can all applaud. Go ahead, you can do it. The future health of our people will depend in part on you and your professional colleagues. Some of you will go on to develop new procedures, treatments, and preventive strategies. Today, we can only imagine what you might dream about that will become the advanced practice of tomorrow, to be listed among the greatest accomplishments of the 21st century. We know that for you, this has been more than the usual challenge of grad school. You did it while our campus, country, and the world were struggling with COVID. You more than survived. You thrived. And you did so with great adaptability and persistence, and we are all proud of what you accomplished. So graduates, take a moment to look around you. This is a day to rejoice, to reflect on how far you've all come. Look at new appreciation at the women and men sitting next to you, who've been your classmates and thrived with you. Persistence paid off. Now the people you're sitting with are accomplished health professionals too. And some of the friendships that begin here may continue for your lifetime. 20 years from now, and I hope I'm here to see it, I am sure that your reunions will be filled with endless war stories about the crazy grad school days of COVID way back in the early 20s. So in summary, you are tomorrow's generation of health professionals and leaders. You are. Never in our shared history has the work you have prepared for been more vital. You have much to celebrate in your academic and clinical achievements at New York Medical College. Be proud of where you came from. Show gratitude to those who have helped you reach this milestone, and thank the supporting players throughout your life. My fondest wish for you is that you find professional and personal fulfillment using the tools you've acquired here while making this world a healthier place. So thank you, and my sincere congratulations to the class of 2022.